Mobile phone induced cervical spondylosis. This condition is also known as text neck syndrome. As we all know, due to the use of mobile phone, we all bend our neck a lot. And when we type messages, at that time also we bend our neck. So this result into cervical spondylosis. As you can see here in the image, here a picture is showing that a person is using mobile phone or he is typing something, and that will result into the bending of the neck, and this eventually results in the cervical spondylosis. So text neck syndrome is a condition where there is a degeneration or it is an overuse injury of the cervical spine, and this degeneration occurred due to the repetitive stress on the cervical region, especially when we do forward bending or we flex our head for the prolonged period of time while looking at the mobile phone or the computer screen. So this condition is known as text neck syndrome or the mobile phone induced cervical spondylosis. Here you can see that there is a bending in the cervical region, and here also there is a bending in the cervical region, not only in the neck but also the whole spine. The curvature of the whole spine is disturbed. Here is the right posture, how we can sit and see the position of the spine. The spine is straight, especially in the cervical region. We can see there is a slight lordotic curve, but when we use the mobile phone, there is a excessive bending, forward bending, and that will result in the spasm in the cervical region, and this spasm lead to the compression and the tightness in the muscles, and that will further compress the cervical disc, and the pain will come to the both the extremities from arm to the forearm and to the wrist as well. Here we can see a posture where a person is sitting working on a computer. This is the correct posture. Back is straight, neck is straight, but here we can see due to the chin poking, there is a bending in the spine, and this will provoke cervical spondylosis. And not only cervical spondylosis, there is a pain in the lower back as well. So here is a chart. This chart is depicting that how much stress or the weight come to our neck when we hunch while using the mobile phone. So at a 0 degree, in a normal adult, normal individual, a mature individual, at the 0 degree bending, when there is a 0 degree bending, there is a 5 kg of weight that comes to the cervical spine. But when we bend our neck at around 30 degree, there is around 80 kg weight that comes to our cervical region. But when this angle increase to 60 degree, as we use this mobile phone, there is around 60 degree of the angle forward bending occur. There is a 27 kg of weight that comes to our cervical spine. So just imagine how much stress come to our spine when we use mobile phone, and that will result in the early cervical spondylosis. So symptom will be patient complain that there is a stiffness in my neck, there is a spasm in my neck, there is a tightness in the muscle, the pain which could be localized or diffuse, sometimes it is dull aching pain, sometimes the pain is stabbing. Pain might radiate to both the upper extremities from arm to the forearm and then to the wrist and thumb. There is a weakness in the shoulder joint muscle. Patient might complain that there is dizziness, and patient might also complain headache. There is a thoracic kyphosis. There is a hunch in the thoracic region, upper back region. There might be early arthritic changes in the spine. There might be spinal degeneration, early spinal degeneration and discompression. So how we can prevent all this? So very first thing that we have to do is to avoid excessive usage of mobile phone or the smartphone. Secondly, if we do any job that needs computer or smartphone, then better to take frequent rest in between. We need to take breaks in between. Avoid prolonged static posture. It is very important to change your posture after every half an hour. Reduce stress on head, neck, How we can reduce the stress on head and neck? By taking some amount of stress on the upper extremities rather than taking whole the stress on the head and neck region. Avoid high repetition movements for prolonged time. Suppose a person is typing continuously or sweeping something or doing a specific type of job. So in that, try to avoid high repetitions. And also avoid holding large or heavy mobile phone in your hands for a prolonged period of time. Other than that, physio is a very good option. Ice or heating pack in acute condition. If a pain is too severe, there is swelling in your cervical region, then go for an ice pack. If you see that there is a tightness, there is a spasm in the muscle in the cervical region, then take heat packs. Regular neck movements are very important, especially neck bending and rotation. We can do chin tuck exercises. Chin tuck exercises, you can check on the net easily. These exercises are videos of these exercises are available. These are the opposite of chin poking. Then at the same time, we can do some form of soft tissue mobilization in our cervical region. At the same time, neck stretching or strengthening exercises are of benefits. Then posture retraining home exercise program. Posture retraining means correct posture. As you have seen in the images above, how we can use the correct posture, like you are sitting working on a laptop or a computer. Maintain the correct alignment of your back. Your neck should be straight. And home exercise program, simple basic exercises of the neck and the shoulder on a regular basis will prevent this condition, which is the mobile induced cervical spondylosis. I hope you have liked the video. Keep watching our videos for such more kind of content. Have a good day.